O'Brien, and we welcome our live viewers and those watching the replay. This is Let's Talk, a series from Gift of Life, Michigan. What we talk about is the importance of organ and tissue donation and the questions people have. Today, we're talking about how COVID-19 has affected organ and tissue donation. I'm Patrick O'Brien, Chief Communications Officer for Gift of Life. Joining me is Bruce Nicely, Chief Clinical Officer. Hi, Bruce.
Good afternoon, Patrick. Hello, audience. Whether you're live or watching the recording, welcome.
Welcome. Bruce, I can't wait to learn about how donation has had to adapt during the time of COVID. We also have a special guest a little later in the show, Amy Bacon, a heart transplant recipient and COVID survivor. So we thank everyone for joining us today, and we encourage questions and comments in the chat. Give us a thumbs up if you're watching us right now. And before we get started, here's a look at how Gift of Life Michigan has handled COVID over the past year. Fantastic. Bruce, I'm always amazed at how busy our clinic is. You have organ and tissue recovery specialists. We have a lab here on site. We have a surgical center. We have people who go into the hospitals to work with hospital staff and grieving families. So much happening, but organ and tissue donation continued during COVID-19, didn't it?
Never paused, Patrick. That's right. The need remains today. While we had to adapt, and certainly everything was affected in many different ways, we had to persevere. There are a lot of folks depending upon us. Folks we'll probably never meet, but 114,000 people on the waiting list for an organ, and up to 2 million people a year are benefit from a tissue donation. And people often don't realize the magnitude of tissue donation. So throughout this pandemic over the last year or so, we certainly adapted. Our folks have persevered. They have a profound dedication to this mission, And as they say, it takes a village, and our village is about 250 people who directly work for Gift of Life Michigan, but an army of volunteers, countless partners in the hospitals, and certainly in the community at large, all combined to make this miracle happen. And we have plugged away throughout this pandemic, but we plan to continue to do so.
So what was the biggest impact on all of this, and what was the biggest sort of challenge you were facing with when the pandemic hit?
So that's quite a list, Patrick. I think at the top though was safety. So we needed to keep our people safe. Clearly we needed to keep patients safe. And you remember early in the pandemic, hospitals severely restricted visitation in an effort to sort of curb the spread of the virus. Some of those measures are still in effect today. Certainly for us, they are, because we serve about 145 hospitals or so, so our folks don't know on a given day which of those hospitals to be going to. So sort of a global approach to keeping our folks absolutely as safe from the virus as we could drove a lot of our response early in this pandemic, and it continues to be a huge topic of conversation today. I'll also tell you that early in the early parts, a lot of tissue use was affected because hospitals stopped doing elective procedures. And an elective procedure, while certainly very, very important, often can be postponed without any harm to the patient. And many of the operations that use human tissue get classified as elective. So those were put on hold, and so not quite as much tissue was needed for a couple of months there. For organ, we saw a big dip in about April of last year as we were all trying to understand what the virus was, how the virus affected people, what its longer term effects were, what the risks were to somebody who looking at an organ transplant. So while it dipped, it never disappeared. Kidney programs, very rightly, were highly selective and extremely careful about who they transplanted, particularly at that part of the pandemic. And we and they all together were assessing those safety precautions, what to do and how to do it to continue to keep everybody safe, and at the same time keep getting people transplanted. Because I've said this before, Patrick, but unfortunately, the end stage organ disease that lands somebody on a waiting list doesn't take a pause because we have a pandemic. So we've had to adjust rather than pause.
How has Gift of Life Michigan protected patients in this time of COVID?
Certainly, testing has been a sort of the gold standard, Patrick. So as soon as FDA-approved testing became available last year, we implemented testing of every organ donor and every tissue donor routinely. So we have done that since the beginning. More recently, we added a different type of test. We may talk about that a little later in this discussion.
Yes.
Interestingly enough, the FDA that regulates tissue donation in the United States still has not recommended testing for tissue donors. The belief there is that the modifications that are performed on tissue before it is implanted into a recipient would eradicate any virus, including the SARS-2 or COVID-19. Nonetheless, to be absolutely on the side of caution, most of the tissue banks that Gift of Life Michigan works with do require a test of the donor so that they know what they're working with. So testing, and then along with that, Patrick, a fair amount of history review. So learning all we can about the donor from their family or available medical records and such. And of course, a physical assessment. Those all sort of fit together to give us as complete a picture as we can paint of the donor's condition at the time of the donation.
Just for background for our viewers, up to 8 life-saving organs from one donor. Is that right, Bruce? And up to 75 people can be saved through tissue donation from one donor. Can you describe for the viewers what some of those organs are?
Absolutely.
What some of the tissue recovered could be, just so people get a sense of what you're talking about when you say organ versus tissue.
You bet, Patrick. So organs most of us would recognize as solid organs in the body: the heart, the kidneys, liver, the lungs, the pancreas, and then in some respects, we're up to 9 or more organs. So, for example, the small intestine can be transplanted, but also we have another whole category called vascular composite allograft, VCA. That captures the things that we've seen some extraordinary stories in the press. These would include face transplants or a hand transplant. So they're similar to a solid organ in some respects. However, they usually involve other components of tissue and vasculature, nerves, and so forth. It's a very extraordinary opportunity to help others or save lives. One example of a VCA transplant is a uterine transplant, where a woman of childbearing years, for whatever reason, either doesn't have a uterus or doesn't have a functional uterus, a donated uterus can be implanted. The woman can become pregnant and carry the fetus, the baby, to term, deliver. Then
Amazing.
the donated uterus is removed.
Amazing.
Then in the category tissue, probably the most recognizable form of tissue is skin, Patrick. Many of us have heard of or know of someone who has been burned or otherwise injured in a fashion that requires a skin graft. Donated human skin is an extraordinary bandage, if you will, to help the patient's own skin rebuild underneath and sort of almost replace that graft. And so while it's temporary, it's extraordinary, and it's also life-saving. Other implantable, transplantable forms of tissue would include tendons and ligaments. So we all hear about that person who tears their ACL, anterior cruciate ligament, skiing or playing basketball or things like that. Excuse me. Very commonly, some donated human tissue is used to reform and reconstruct that ligament in the recipient. And then there are a host of forms of bone, such as for application in neurosurgery, lots of orthopedic and spinal applications, even a lot of dental applications. So the uses of tissue have grown exponentially over the last 3 or 4 decades, to the point where, like I said, up to 2 million people a year actually get some type of tissue.
So some of those operations were elective and were put off during the time of COVID, but as far as organs, those continued. And we had a case where in the state of Michigan, where there was a lung recipient who contracted COVID from that organ donation. So can you tell us what happened and what is it that's being done differently now so that very rare thing is unlikely to happen again? What happened, Bruce?
Sure, Patrick. And the key word in this is rare. It was a tragic event, but in brief, there was an organ donor in another state. When the match run, that's the list of recipients for any organ that's donated, was generated, a patient here in Michigan was at the top of that list. And the center accepted those lungs and traveled to the place where the donor was to recover those lungs and bring them back to Michigan. It so happens that we get to Lake Michigan, partner with University of Michigan, and we provide organ preservation and perfusion services for their surgeons.
So what that means is that we help prepare that donated organ so that it can be transported and be ready to be transplanted.
That's right. There are some federal mandates on how organs have to be packaged and protected, how they have to be labeled to ensure the safety of the recipient. And so our team provides that service. And so the recovery of the organs was very smooth. Everything went fine. Excuse me. The transplantation also went fine. However, after the transplant, the patient really did not seem to have some signs and symptoms of something going on. Despite having tested the recipient prior to the implantation of the lungs, and despite negative nasopharyngeal swab test on the donor, it was discovered a day or two after the transplant that the recipient was in fact COVID-19 positive. In this case, the lung team, the surgeon, had actually done a bronchoscopy on the donor, and that's not unusual. A tube is inserted down the airway. They can look around in the lungs. They can clear blockages. It's a pretty handy thing to be able to do, right? And in the course of doing that, they collected what is known as a bronchoalveolar lavage, a BAL. And they just sort of brought it back with them. They didn't see anything unusual about the lungs. There was nothing questionable. So they brought it back with them. In light of the positive COVID test in the recipient, they went ahead and sent that specimen off. Remember, it was collected from deep within the organ donor's lungs. Unfortunately, that specimen tested positive for COVID-19. So in fact, the recipient now had contracted COVID-19. And not only that, the transplant surgeon who put the lungs in also contracted COVID-19. The outcome was, I'm sorry.
I was going to say, so sadly that patient died. Didn't that happen?
The patient died, Patrick. That's right. By heroic efforts.
Such a tragic case. But what was learned from that is that deep test that you just described is now commonplace, right?
It is, Patrick. It's been an interesting evolution. We've learned a lot about this virus over the last year. We speaking sort of globally. At the beginning, though, we did know that the virus seemed to spread most prolifically through aerosol or spray, if you will. For that reason, a lot of laboratories were very reluctant to let their people handle specimens that were collected from deep within the lung. And that is, in fact, true. That is how the virus spreads most easily. We also earlier thought the survivability of the virus on surfaces was a lot higher than it really is in actuality. So we fast forward, Patrick, and our reality now is that labs are more comfortable handling those specimens. The surgeons or others who collect those specimens do it through a closed system. So at no point is the aerosol, if you will, nobody can come in contact with that directly. And the FDA has approved testing more universally, excuse me. And so we have the capacity and took full advantage to run that on any donor that could even potentially donate lungs. And so that's now our common practice at Get the Life Mission.
So over the course of a year of a pandemic, and there are 57 organ procurement organizations across the United States, and all of these organ transplants occurred during this whole period. And out of all of that during this pandemic, there's one organ recipient who contracted COVID from an organ. That's how rare this was. And now there's a test that is going to make that even more unlikely and more rare.
Absolutely, Patrick. Yes. I've had the privilege to work in this field for many, many years. Things like this crop up from time to time. We've had Ebola, West Nile virus, HIV, AIDS, hepatitis C. So there's quite a number of infectious agents that tend to show up on the landscape from time to time. We adjust and learn, as does all of society, how to deal with them, hopefully how to prevent them or cure them or treat them. And you're absolutely right. Despite this truly tragic case, thousands of other transplants happened without incident and without infection. We now know that the lungs are the very most organ to infection.
And so it's unlikely that anyone with COVID is ever going to be, having their lungs transplanted. That's kind of obvious that's too risky and not ever possible. But what might happen with the future with COVID and transplantation?
So that's now we've sort of pivoted to start looking at that, Patrick. With the virus having been on our consciousness for a year or so, people unfortunately continue to die from other reasons, and some of those people might have had COVID-19. Some of them might have a positive test currently. Does that mean no organ can be transplanted? We don't believe so, and the evidence, scientific evidence, does not suggest that would be the case. It does suggest that we're going to have to kind of take a step approach. So first, for example, is that we will look at a donor referral of someone who might have had COVID-19 previously. If there's a positive COVID-19 test reported on a potential donor, we'll look at the whole picture. Did they have any signs and symptoms of the illness? Were they exposed to anyone with the illness, et cetera, et cetera. Further down the line, there will be more information about the potential effect, if any, COVID-19 might have on other organs. We know it affects the lungs, but does it affect the liver or the heart or the kidneys? Early indicators are not the liver and not the heart. possibly a tiny bit with kidney, but again, that's yet to be determined.
Well, and it's funny that you bring up kidney. We've got a couple of questions, Bruce, from those watching, and Valerie is asking, can kidneys from COVID-related deaths be donated?
Okay, so the jury is still out. Early evidence suggests that there might be some indication for the recipient, and we need to understand more. So Valerie's question is a great one. Taken in the broader context, we would assess every donor and potential exposure to COVID-19, et cetera, et cetera. And along with the centers who are looking at that organ for their recipient, make a decision that makes the most sense. Also with kidney, clearly the vast majority of the waiting list is kidney patients, and we want to get them transplanted. The other side of that coin is that the kidney patients can often have a better quality of life with a better survivability rate if they don't get a transplant right now. I don't want to ever suggest it's elective. However, the kidney of all the organs does tend to be a little more flexible. And so for that reason, I think Valerie and everyone else, the surgeons, are able to use pretty extreme caution in considering a kidney for their patient. So taking all of those factors together, Patrick, there's probably no one uniform answer, but rather to look at each circumstance.
We have another question from a viewer about whether recipients should get the vaccine, especially if their donor was vaccinated.
Clearly talk to your provider, but my understanding is that they will. The transplant side of things will be strongly encouraging the vaccine. But if you are a recipient or you know a recipient, please talk to your provider about whether and when to get that vaccine because of the other immunocompromised elements of taking care of a transplant recipient. So please talk to your provider.
Great. Thank you, Bruce. Next up, we've got a special guest. We've got Amy Bacon, who's going to be joining us, Bruce, and she is a heart transplant recipient. Welcome, Amy.
Hello.
Hi.
How are you doing today?
I am doing pretty good.
Well, we know a part of your story is that you're a heart transplant recipient, and we want to hear about that, but you also had COVID, right?
Yes.
So tell us a little bit about yourself and your journey. Tell us your story.
Okay. Well, I had a sudden cardiac arrest March 19th, 2009. Had no symptoms or anything. And a couple of years later, it progressed to congestive heart failure. At that time, I was told that I needed a heart. So I went from an LVAD and I was donated on June 26, 2012. Since then, I had fared fairly well. But last year in April, I contracted COVID. My symptoms were not atypical. And so I had a really hard time in April even getting the test. And so U of M had to do a little bit of finagling to get me the test. And so when I tested positive, I was floored. My symptoms, like I said, were gastrointestinal. I had a lot of heart issues, a lot of palpitations, lack of appetite, just fatigue. And so I ended up having a heart monitor for a long time. Then in June, I tested positive again. And during April and June, my cardiologist took me off of one of my anti-rejection medication to raise my immune system so I could fight. I was still testing positive in June. It wasn't until August that I started to test negative. Consequently, I am in a low-grade rejection right now. I've developed donor-specific antibodies. We're not really sure if it was because of COVID. It could have been because my immunosuppressants were lessened. We're not really sure. I did have blood work done 2 weeks ago, and I have antibodies for COVID. I haven't had any vaccination. So months and months and months and months later, I'm still showing that I have antibodies. So at this point, we don't really know if I, in fact, need the vaccination. We don't know. I have some tests coming up on April 7th that is going to be the deterring factor. We'll look at my donor-specific antibodies, and we will look again at my COVID antibodies and go from there. I tell you, but since then, my fatigue, my energy has not came back. I'm still quite lethargic. I have bouts of migraines and gastrointestinal issues, and it's been a challenge. It really, really has. I think that once you have COVID and you maintain those antibodies, it's a novel disease. We don't know everything that we need to know about it. And I feel like I haven't really recuperated 100%. I'm almost there, but still not quite there.
Wow, what an ordeal you've gone through.
Yeah.
And so many stories of COVID, but your story is so unique because of your heart transplant. And out of all of what you went through, what concerned you the most about over these last few months, what you were facing?
When I tested positive in April, I wasn't really scared because I wasn't that sick. But when I tested positive again in June, that's when it really hit me, because
this isn't going away.
And then I was around my mother without a mask, and so I thought that after a couple of weeks, because theoretically we thought that you only have COVID for a couple of weeks, and so I had lowered my mask. I'm around my family, and I'm like, I haven't been around my mom. So that was my biggest fear, that I could have possibly infected other people. So in June, oh my God, I bawled. Like, oh my God, I was just like, no, how was this human? What? And finally in August, I started to test negative, but I have had more COVID tests than I can shake a stick at. Like literally, it's not a pleasant procedure, but yes, I can't even count how many COVID tests I've had. And I've got some procedures coming up at U of M, and even though I have antibodies, I still have to test for each and every procedure. So it's an ongoing battle. And with organ donation, it's not a cure. It's just basically a way to extend your quality of life.
Well, and I am sure you are thinking, I can't imagine how you must have felt when you received news that you were getting a heart. And yet to have COVID come and put that in jeopardy, it had to be terrifying.
I remember when I got the call for the heart. It was so funny. I was at my mom's house, and the heart transplant surgeons at U of M are Dr. Pagani, Dr. Romano, and Dr. Half. And when we learned that Dr. Half was going to do my surgery, my mom was like, well, no, where's Romano and Pagano? We need an auto at the end. And so she requested, yes, I'm an adult, but my mom still requested she talk directly with the surgeon. And so my donor was considered high risk, because if the patient has tattoos or body piercing or recent incarceration, they consider that high risk. And I'm in the background like, I'll take the heart for $200, Alex. And my mom was like, well, no, we're going to wait a little bit. And I remember Dr. Half saying, Amy is living off a mechanical device that could throw a blood clot at any second. And so we decided to move forward. And I remember when we got to U of M, on the 4th floor, it was like a huge celebration. I'm like, I'm going to get a heart. And, people in the hallways, and they were clapping. It was like a big party. And then the prep started, and the prep was grueling.
Oh.
Okay. Like the art lines. And I remember when the anesthesiologist came in, she looked like she couldn't have been any more than 12. And she had her white jacket on, and she had all these vials of medication, and I was a nervous wreck. And she was like, I've got something for you. And she was my IV, and I was like, I'm fine now. And it was such a blessing because my mom was literally able to see Dr. Half walking in with the little igloo with the heart in it. And she was like, "Is that my daughter's heart?" And he shook his head. And so before I went into surgery, everyone stopped and we prayed. And I remember when I had my LVAD surgery, I was they had me unconscious intubated for 3 days. But when I had my transplant, oh my God, I woke up the next morning like bing. Like I had a burst of energy. I remember I was being followed by Dr. Nolan, I believe, and I'm on the internet. I'm trying to book a flight. He was like, what are you doing? I mean, so they give you so much steroids. I was on 60 milligrams of prednisone, and I was just like nonstop. And so since then, I mean, it's been all in all, other than chronic migraines and stomach issues, I have had a pretty smooth transplant journey. I'm almost 9 years post, and I'm just now showing donor-specific antibodies. So all in all, I'm in a good place. COVID and all, I survived COVID. I beat COVID.
That is wonderful to hear. That is great, and you're such an inspiration.
Thank you.
Wow.
Patrick, Amy alluded to something that's very interesting. I said a few minutes ago that we encounter new viruses or pathogens from time to time. And 9 years ago, when Amy got a heart transplant, she mentioned the donor was classified high risk because tattoos, incarceration. Interestingly, just last year, the Public Health Service updated those criteria again. And so now we don't call any donor high risk. We simply say there may be risk factors for the transplant center or surgeon or patient to consider. And with the benefits of NAT testing, PCR testing, the window, in Amy's case 9 years ago, if the donor had been incarcerated any time in the last year, even for 72 hours, that would have classified the donor as high risk. Now the exposure would be limited to the last 1 month. And so it's always evolving. And as we learn more, we're able to do more and be more realistic about things. I'm glad Amy brought that up. And Amy, keep up the good work. We're glad you're doing well, and keep doing well.
I don't know about you. I don't know about you, Bruce, but I think Amy has a great energy. She's got, if you're suffering from COVID, you don't look like it from here. So
Thank you.
Have that energy.
You're doing well. Thank you. Yeah. Thank you so much for joining us. What I agree with Shalonda, what an amazing story. And thank you so much for sharing your story with us. Amy, what do you recommend to someone who is considering or adding their name to the organ donor registry? There's a need, isn't there?
There's definitely a need. And I look at what I've been able to do post-transplant. I've gotten several degrees. I'm working on my doctorate in public health, and I've made it a point to educate the community on the importance of preventative health. And so for me, it has aligned me and put me in a position where I can be a service to other people. I'm very involved with the Gift of Life. I've done several solid organ recruitments. And so my advice is, please sign up to be a donor. One person can save up to 8 people and up to 75 people just with skin and tissue and bone. It's the most selfless gift that you can give. And I'm a walking testament. I am forever grateful that through the most tragic of events, my donor's parents decided to give their child's heart to me, because I wouldn't be here. All these wonderful things that I'm able to do, I wouldn't have had the opportunity. I am forever grateful for the Gift of Life, for the University of Michigan, for my surgeons, Dr. Bagani, Dr. Half, and I'm excited for what the future holds for other organ recipients. Another bit of advice is, even though you might be on the kidney transplant waiting list and you might be going through dialysis, be proactive. Seek your own donors. That is a possibility. Solicit, and don't give up, because life is great on the other side.
Amy, you are an inspiration. Thank you so much for all your advocacy and what you do for Gift of Life Michigan. You too could save a life like Amy's someday. If you have not added your name to the Michigan Organ Donor Registry, you can do that, as well as learn about organ and tissue donation at Gift of Life Michigan's website at golm.org. There are also lots of great resources about organ and tissue donation, transplantation, and COVID-19 on Gift of Life's webpage, golm.org/COVID. Shortly after the pandemic hit, 6 transplant community organizations teamed up to form the COVID-19 Transplant Community Coalition, and they created a central resource hub to help the transplant community navigate these uncertain times. And that website is right there for your information. So, Amy, thank you so much for joining us.
You are welcome. You are very welcome.
Bruce, where does a guy like me get a jacket like that? That's my final question.
Detroit, Patrick,
Detroit. Bruce, thank you so much. And thank you to all of our viewers. Please follow us on social media, on Facebook, on Instagram, on Twitter, and visit us at Gift of Life Michigan's website, golm.org. Thank you, everybody.
Thank you, everyone.
Thank you.